The internet is very important to the Rarotonga Hospital. I feel that as we've come along, we're actually utilising this service in a lot of ways. I think the use of video conferencing during surgical procedures would be a great potential to have in the cooks. I think when doctors are able to link up with a counterpart in New Zealand, just to guide them through certain procedures, and for those guys in New Zealand to actually see what's going on, I think the potential for us to actually do a lot would be great.
Connectivity is always the first highway that brings people in communities to life. As time passes, we will be addressing areas like health, telemedicine, education, e-learning, e-governance, public safety, and other data services and voice services that would be required in those parts of Pakistan where there is no connectivity.
With the greater speeds, we hope to utilise that technology to get diagnosis from experts overseas using the video conference technology. With O3b, we now have a chance to do that.
I think what will improve is the ability to actually probably develop key presentations to the community, and I think that would be a key for them. So I think there's an area within the Ministry of Health that would probably benefit quite a lot from this.
We've started to see changes in medicine where telemedicine, video conferencing is starting to be used now, whereas previously you couldn't do that in a geostationary environment. So I think in all sorts of walks of life, we've started to see the difference that having low latency, high throughput can mean.
The biggest impact is going to be on our learning outcomes, particularly for our field-based teams, being able to train and upskill themselves constantly while still delivering services in the districts and not have to come to Delhi every time and stop delivering services because they needed to attend a training of some sort or another. Because we now have the sufficient internet speed to be able to do that.
Saving time and freeing up our staff to spend time providing health services rather than doing data administration.
We also have access to something called the International Learning Gateway, which is an MSI data hub, if you will. And until very recently, we couldn't download a lot of the training and learning materials from this gateway because the internet would time out or the data files were just too large to send. Now we're actually able to access a lot more of our information from the gateway, which helps improve the quality of the service that we provide to women in Timor-Leste.
Well, I believe everybody should have the right to information and be connected, but from my perspective, education and health information would be vital.